Good morning, all committee and all audience. My name is Phattharaphon Prapatsorapong. I am the Phabtharaphon National Institute medical student from Mahidol University, and the represent of our research group called the success rate of direct endotracheal intubation, comparing between trend by using direct versus laryngoscope in inexperienced medical students. And we have Dr. Shishinok Chuongkomon is our supervisor. She is an associate of Maharat Nakhon Hospital. May I introduce the importance of our subject? Endotracheal tube intubation is main procedure in area management of medical providers. Uh, in experience of that can increase risk of failure and complication while doing the procedure. While utilizing the video laryngoscope itself is proven to enhance the success rate. After searching the research which related with our subject, there is limited evidence for the question did the training process is improve success rate in intubation. So this study aim to evaluate and compare uh, uh, success rate of novice medical student in endotracheal tube intubation with use direct laryngoscope after training with either video laryngoscope or direct laryngoscope. The process of the study we take a couple weeks to searching the study for that relate with our subject. Next, we consult our supervisor and got the planning of the project. Then it's time we collecting data from medical students, and the last one we got data and we calculate how significant of the data, and we got conclusion, which I will present you in next paragraph. Uh, the process I told you it take place from 27 July 2023 to 27 April 2024. We use the prospective randomized control trial for this study. The participant we use a medical student who are inexperienced for intubation. They were randomly to assign for two groups. One is the direct laryngoscope groups. I will call DL group for time saving, and two is video laryngoscope groups, is VL groups. They underwent a single session for instruction and equipment familiarization. Uh, then we assessment them. The data we have we collect five things. One is laryngeal view. We use comma error hand classification. Two is, two is success of intubation, and three is time of intubation. We use begin in open mouth until ambu bag is connected and the chest move is observed. Four is complication of intubation. We collect the teeth injury from the mannequin. And five is researcher satisfaction. In summarization, there was no difference in success rate of endotracheal intubation of the video laryngoscope groups and direct laryngoscope groups. However, the video laryngoscope groups demonstrate a better laryngeal view compared to direct laryngoscope groups, and increase the satisfaction level for the video laryngoscope groups, but no statistically evident that VL group and DL group has more intubating time and success rates. For the conclusion, the training by the video laryngoscope is effort a laryngeal structure and enhance satisfaction level than direct laryngoscope groups. Thank you.
For the first question, I'm wondering to know how about the You use the mannequin or the real patient that you have to study.
We use the mannequin.
So the medical student is naive, not have to train before in both group.
They inexperienced into intubation, but we got a session for their training before the assessment.
Okay, thank you. In both two groups, I mean, the duration of practice is equal or not?
We have just one try for him. One attempt before we collecting data.
That from from practice to the real assessment is equal for both groups.
A little different, but we have just one attempt for them.
Could you, really interesting, thank you. Could you explain a bit more about how, for example, you measured the beta-laryngeal views and the satisfaction levels? Were the students asked with a Likert, or was this from the supervisor? Thank you.
When we collecting data, we have a photo of Comac classification of laryngeal view. When you put the blade and see the laryngeal, I will ask the participant what view you have. You see what classification. And the satisfaction, we collect for two one. For is very excellent, and one is bad for their experience.
So the assessment is from student only, or are there any teachers assessment of the success?
Just medical students.
So what is your plan from your research? Are you going to tell the directors of your hospital to use VL or not?
In our hospital, it teach with video laryngoscope, but it can be for another medical school that we see the research, maybe they can apply to use the video laryngoscope for school.
Were you surprised at the results, or were they what you thought they would be?
It's really what I thought.